Good morning, Bespoke Babes. It's Dr. Kim. This morning I want to talk to you about fat grafting versus filler. And I know you're all really familiar with the filler products, the hyaluronic acid fillers, because we've talked about them quite a bit. So those are our Teosyal, our Belotero, Restylane, Juvederm, that you're all very familiar with. These are our hyaluronic acid gels. They come in different consistencies that we inject to lift and give some volume back. Cheeks, jawline, lips, temporal fossa area, tear troughs, all of these areas that we do our injections. As you know, these products last anywhere from 6 months to 18 months and slowly dissolve away. So one of the questions that I commonly get is, isn't there something I can do that is going to last longer, that I'm not going to have to come back every year to 18 months to have injections redone? And the answer to that is yes. We have some options, but each option has pros and cons. So let's go through those. So fat grafting is an alternative to our hyaluronic acid fillers. And what fat grafting is, basically we do a little bit of localized liposuction and take fat from a spot that you don't want it. So let's say your thighs or your tummy or wherever it is that you don't want that fat. Process it through a specific mechanism to take out the intact fat cells, because of course when we do suction, some of them burst. So we want just those intact, healthy fat cells, and then re-inject them. So we're putting the fat back into spots where we would put fillers. So we can fill along the cheeks and give some lift and volume. Now, plastic surgeons have been doing fat grafting for a really long time in conjunction with facelifts, because as we've talked about before, the 4 elements of aging include both tissue descent, sliding down, and volume loss. So we want to correct both of those. So when we were doing a facelift to correct tissue descent and lift and take skin away, adding some volume back with fat grafting really helped improve the overall results of a facelift. But we can also do fat grafting on its own. So a little bit more involved than our fillers, because of course we need some anesthesia. We have bruising and swelling at the donor site and healing that has to happen there. And there's a lot more healing that goes into fat grafting than there is from injections of dermal filler. So fat grafting, the cannulas that we use to inject are much bigger, because of course the fat itself is thicker than the hyaluronic gels. So we have some healing at what we call the donor site, and also at the grafting site. It swells much more, it bruises much more, it's much more sore afterwards than our hyaluronic fillers. The fat that goes in, approximately 60 to 70% of those fat cells will actually stay. They need to get a new blood supply and remain healthy. And anywhere from 30 to 40% of what we inject will not get a new blood supply and will simply dissolve and be cleared away by your body. So that means sometimes, just like with fillers, we have to do it over a couple of sessions to get the results that we're looking for. Now, fat grafting is not, we can't finesse it as much as we can with fillers, because the cannulas are bigger and the fat is larger. And that means I generally don't recommend doing fat into the tear trough, because we don't want to end up with lumpy, bumpy tear troughs. I generally don't recommend doing fat into the lips. Again, it's harder to finesse the shape and a little less predictable. And I generally wouldn't recommend doing fat around the eye. Again, we don't want to end up with lumpy, bumpy, unpredictable fat. So fat grafting, the other thing to remember about it is that fat continues to act like where it came from. So we really only do fat grafting on people who are at a stable weight, because let's say, for instance, we take fat from your tummy, we put it into your face and you gain weight. If your body likes to gain weight on your tummy, you're going to put it on your face, because those fat cells continue to act like where they came from. So fat grafting is a great technique. We use it a lot. We use it at the time that we do facelifts. It really is a valuable technique in rejuvenation, but it also has some downsides. And so when you're deciding between filler and fat grafting, you need to kind of balance those for yourself. Other alternatives that can last longer than our hyaluronic fillers are, of course, our biostimulators, our Sculptra, and our Radius, which again, we can finesse a little bit more than our fat grafting. But fat grafting is definitely out there. It is definitely an option. So when you are weighing your options and your rejuvenation techniques, it's something we can definitely consider, but it is not an exact replacement for our hyaluronic fillers, and I think that's important to understand as well. So of course, if you have any questions, as usual, make sure you post them, message us, and I'll answer them for you. And of course, if you have any ideas from videos, I'm always happy to answer your questions. Have a great day, Bespoke Babes.